Good afternoon, everyone. This is Laura Weed with the Department of Behavioral of Medical Assistance Services. We're probably going to give it one more minute. I can still see the numbers climbing to make sure we have as many people as we can get before we get started. Thanks for being here today. All right, it's 2:01. The numbers are still climbing of attendees, but we're going to get started. Welcome, everyone. Thanks for being here today. You are in a webinar for Medicaid Behavioral Health Services Redesign. We are we have launched a 2-year project to redesign our community mental rehabilitation services. And today's webinar is specifically for providers of those services, as well as some specific evidence-based programs, in hopes that we can get some really great information from you all and some feedback as we move forward in our redesign. And our Mercer team is our contractor. They're helping us with this large project, and they're going to be providing the majority of the information today, but I wanted to go over a couple of logistics before we get started. Go to the next slide. So today, we're going to give an overview, a very brief overview of the redesign project. Then our Mercer partners are going to talk through the survey and what to expect when you fill out the survey. And then they'll talk about a couple of additional things at the end. Go to the next slide. So let's talk about some logistics of the webinar today. Everybody is muted as well as their camera is off. That is so we can get through the presentation, and also because of internet bandwidth issues. But just for everybody's knowledge, we are recording today, and a link will be put up on our website. We'll be launching a new webpage for this project very soon. So once that's launched, it'll get put on our website. You all did register for this webinar, and so we will be sending out the PowerPoint to the individuals that registered for the webinar, and eventually we'll put the PowerPoint up on our website once that gets up and running. We will the Q&A function is live. If you have any specific questions about the content of the webinar or the survey, please put your questions into the Q&A function. You should find that at the bottom of your screen. And when you submit your question, if you could please provide your name, your agency, if applicable, and an email where you can be reached. We may be reaching out to you individually with answers to your questions if they're very specific. So please provide that information. We also, just so you all know, we will be having open office hours, which Brenda will talk about later in the presentation. We will have 2 open office hours later in the month for providers to come and go and ask questions as they come up while you all are hopefully filling out the survey. So there'll be 2 other times where you guys can ask questions while you're filling out the survey. It's not just today. So save your questions as well. And if anything comes up, you can come to our office hours. We'll talk about when those are going to be later in the presentation. If time permits, we will probably answer some of the questions that come in, especially if they've been, asked more than once and they're broad and may be helpful to other providers. All other questions will be addressed via email or in our provider office hours, like I mentioned. I think that's it for logistics. Our team will be listening and attempting to answer some of the questions in the Q&A if we can. We're excited to get your all's input and engagement. So thank you all for being here, and I will hand it over to our Mercer partners, Brenda Jackson. Thank you so much.
Thank you, Laura. Could you go to the next slide, please? Thank you. The very first thing we're going to do is just talk very briefly about the context of the project and an overview of the proposed behavioral health redesign changes. If you go to the next slide, the Virginia Appropriations Act of 2024 gave DMAS the ability and the authority to enhance behavioral health services across Virginia for the community mental health rehabilitation services. That includes mental health skill building, psychosocial rehab, intensive in-home services, therapeutic day treatment, and targeted case management for adults and children. In the first year of the project, that includes planning for assessment and treatment planning, organizing services into a possible level of care, and looking at the rehabilitative service components and the professionals that can provide them. If you go to the next slide, the service components that we'll be looking at are all of the service components considered and included under the current rehabilitation services, including rehabilitative strengths-based treatment planning, individual, family, and group counseling, psychoeducation or health literacy training for the family and the individual, care coordination with other Medicaid services, crisis prevention and management, which includes the development of a crisis plan, crisis intervention and 24-hour emergency response for individuals on the caseload, assistance with medication management, and then restoration, rehabilitation, and facilitation support to improve daily functioning. So these kinds of restoration and rehabilitation activities include restoring communication skills and practicing problem solving, anger management, interpersonal interaction, and training to restore functional skills, as well as addressing appropriate behavior related to health, safety, instrumental activities of daily living, and the use of community resources to monitor health, nutrition, and physical condition with goals of self-monitoring and self-regulation in all activities. Also, peer support services. If you go to the next slide, there are some other components included in targeted case management that we'll also be looking at, including linking the individual to services and supports, locating and developing or obtaining needed services and resources, enhancing community integration, making collateral contacts, and follow up and monitoring to assess ongoing progress and to ensure that the services are delivered. If you go to the next slide, in order for us to accomplish this, we will be, at the end of this session, we will be opening up a provider survey for individuals and providers to complete before October 15th of 2024. There are 4 sections. The first is a narrative section. The second is a demographic section. The third is an evidence-based services cost and utilization information. And the fourth is the community mental health rehabilitation services cost and utilization information. We're going to talk about each one of these sections separately, and then we will pull up the survey and show you how it works. So the very first section on the next slide is the narrative opinion section, and there are 3 narrative questions. The first question is, what are the aspects of the current CMHRS that you would like to see the Commonwealth maintain? The second is, what are the aspects of the current CMHRS that you would like to see the Commonwealth reform? And then the third is, what are your worries about the community mental health rehabilitation services that you would like to make sure that the Commonwealth considers? So these are open-ended. There is a lot of room for you to write your answers. We are looking to hear from you all in a very broad sense about what it is that we need to keep in mind as we are looking at this piece of legislation and the redesign. For the second piece, if you go on to the next section, next page, Carly. For the demographic information, this section has several mandatory questions. There are questions 4 through 16 about your agency that you must answer in order to submit the survey. It includes the population served, children versus adults, the number of individuals served by the agency overall, the provider location, and outcome measures that you use currently to document recovery in individuals, and then contact information about your agency and the individuals so that we can follow up in case we have questions about the responses that you've given in your survey. And again, I would point out that until you complete this section, you cannot submit even the first 3 questions. If you go on to the next slide, this section 3 is an optional section, and it's intended for use of providers of evidence-based practices. Specifically, we are looking for responses from providers of coordinated specialty care, high-fidelity wraparound, parent-child interaction therapy, trauma-focused cognitive behavior therapy, brief strategic family therapy, EMDR or eye movement desensitization and reprocessing, dialectical behavioral therapy, managing an adaptive process or MAP, and any other evidence-based practices for which you are trained and or certified to provide. And if your agency only provides assertive community treatment, multisystemic therapy, or a functional family therapy, please don't submit or complete this section. We are looking for answers, very specific answers about how you deliver these evidence-based practices or other evidence-based practices. For example, if you do ACRA or some other, home builders, some other evidence-based practice, absolutely fill this out. So for the next section, for questions 54 to 103, we are going to be asking questions about the community mental health rehabilitation services, specifically about the cost and utilization information. So for these questions, we're going to be asking questions like how many individuals receive the CMHRS from the provider. Remember, on section 2, we asked you how many individuals you served overall. Here, we're specifically asking about the CMHRS services. We're also asking how assessments, treatment plan, and care coordination occur in these services, the number of encounters or visits for these services monthly, the staffing and the staffing costs, the employee-related expenses, the program costs, the training hours and costs, staff turnover, travel and productivity considerations, and other cost considerations such as interpreter costs and overhead. We are looking for you to include the costs and utilization for an entire 12 months of the program and to tell us which 12 months you're including. And then we're going to be including a lot of text boxes for you to explain any nuances. Our goal is to use the responses as some of the basis for the rate setting exercise that we will be doing once the services are redesigned. So we really will need your thoughts and input in this section. If you go on to the next slide, some basic information that you're going to want to know is if, as you're working through the survey, and just so you know, if you answer every question, there are 100 questions, but we are going to be having some office hours in case you run into difficulties about what to do and how to answer a particular question on the survey. So the first set of office hours are from 1 to 3 on September 20th, and the second is from 1 to 3 on September 27th. These are Friday afternoons, and we have set aside Zooms. And so if you go to these team sites, if you go to these team sites, and we will be sending these slides out after the webinar is over, so you don't have to write this all down. We will be sending it to you. but that way you can have the actual links and you don't have to get all the numbers correct. If you go to the next slide, to access the survey, the first thing you can do is you can either have you can scan the QR code, or you can access a survey through the HTTPS site that is listed. Either one of those is accessible, and you can go ahead and the survey is open starting today. So with that, I do think we're going to leave this slide up, and we have 45 minutes now. Oh, actually, we were going to pull up the survey. That's right. Carly, could you go ahead and pull up the survey, and we'll bring this slide back for when we do Q's and A's. So the survey itself is in a Microsoft form. And as you go through this, you'll see at the very top, the instructions are outline what the 4 sections are. And then they start in with section number 1, which are the 3 narrative questions. If you could go down just a little ways. You'll see there are the first 3 questions that we had talked about in the PowerPoint. Excellent. So then if you go on to the next page, Carly, the demographic information starts on question number 4 with does the agency serve children? And you'll see that there are questions about the demographic information, about where you're located, etc., and then also about your agency name. And you'll notice that the agency name and position and contact information are all mandatory. Until you, if you go on down to question number 16, if you all choose no on question number 16, you can choose to submit the survey at this point, but you have to select no. If you are going to be selecting and submitting cost and utilization data for consideration, you select yes, and then you're going to go on to section 17. Or section 3, question number 17. And then this very first question, if you are going to provide information about the evidence-based practices, you can select yes, and then there are a series of questions about the evidence-based practices. But if you are not providing or going to submit cost information about evidence-based practices, you select no, and then you will go automatically to question number 53. So questions 17 through 52 are all on evidence-based practices, and you'll select which evidence-based practice you're going to be reporting on, and you'll have it, and you'll explain that. I would note that the evidence-based practices, there are examples throughout. And as you look at the examples of the evidence-based practices, we have put some examples of how to answer the questions. And we've tried to use coordinated specialty care, high fidelity wraparound, and dialectical behavior therapy as the examples of how to answer the questions. But you can use whatever evidence-based practice you would like to answer the question. So if you could go on to question number 53, Carly. Okay, so for question number 53, if you have answered the evidence-based practices section, they're going to then ask you if you also provide CMHRS. If you select yes, you'll go on to question number 54. If not, if you select no, you'll be able to submit the survey at that point. So question number 54 is the start of section 4, which is where the CMHRS costs and service utilization are included. And then you can select as many services as you want to provide. And you can also select on number 55, you go on down to 55, it asks you to which services you will be providing cost and utilization data for. And you can select how many services you provide the data for and how you're going to provide it. In this case, and you can see we have an example that in this case, it would be providing cost and utilization data only for MHSS and PSR, and that it would be provided separately. And so the examples throughout show you how to do that, but you can also do this for IIHS or TDT or TCM. So as you go through this question, this series of questions, you'll notice that when you get to question number 63, there is a yes or no question. If your agency does not assess or evaluate individuals, you'll put a no, and you will then be skipping down to the treatment planning and care coordination questions. If you have a yes, then you'll be answering questions 64 and 65 and 66. So if you want to go down to, for example, 68, it then asks, does your agency coordinate care with other Medicaid providers? And if you don't, then you can say no, and you'll skip down to the qualifications of treatment planning. So then as you keep on going down to question number 71, then you'll notice that we talk about, does your agency utilize assessments to monitor progress toward treatment plan? And if you say yes, then we're going to ask you a few questions about what assessments you use. And if you say no, then you're going to skip down to the question 75. And the form will do this automatically for you. And if you and you can see then it talks about, what is it like to get managed care organization prior authorization, concurrent review, and post-pay treatment? Are you able to do this in a single response, or are there multiple back and forth responses necessary? And then we also keep going on question number 76 for listing how you're going to be reporting the costs and utilization and how they're organized. And then the rest of the questions then are all on costs and structure of the programs that for CMHRS that you're going to be reporting for. As you go down then, your last question will be down on 103, which is, are there any other cost of living considerations that you would that you make for your employees, etc.? So with that, that's just what the survey looks like. If you could bring the PowerPoint back up, Carly, and just put that Q&A, the QR code in, that would be very helpful. And then I think we're going to see if there are any questions that have been submitted so far.
Hi, Brenda. Yes, there are definitely questions that have been submitted. So, and a lot of them are overarching questions that I think most people will want to know. So, I can go through them one by one. So the first question was a specific question about licensing for these services, which is, as you all know, done by our sister agency, the Department of Behavioral Health and Developmental Services. And at this point in the project, which is a 2-year project, having started in July, and so the first year will be July to June of next year. And in that year, we will be planning for implementation. And one of the things that we will be doing, which we actually just had our first meeting with DBHDS licensing last week, we'll be planning with them about what licensing is going to look like. So at the moment, I don't have an answer for, will my current intensive in-home license be grandfathered in? I don't know the answer to that. But once we have what services we're going to implement and the licenses that are going to crosswalk with those services, uh, ourselves and DBHTS will be working to provide that information to providers as soon as we have it solidified. It should be, if all goes as planned, which we all know that projects never go as planned, but if all goes as planned, we'll most likely have that information by late spring, early summer of next year. The next couple of questions were about substance use disorder services or art services. And just want to let everybody know that this project and survey do not cross over into our SUD services. This is specifically for our community mental health rehabilitation services on the mental health side. And this project will not be affecting any of our art services that are currently in our benefit. There was a question about the slide that described the service components that we're looking at. And one of the service components was individual, family, and group counseling. And I appreciate actually this question because I could see how some of this might be slightly confusing. So again, I appreciate this question. So when we're talking about a service component of individual, family, or group counseling, we're talking about a specific service component that can be provided within one of our community mental health rehabilitation services. So psychotherapy or counseling can be provided via our intensive in-home service or our therapeutic day treatment service. We are not talking about it as a standalone outpatient psychotherapy service when it comes to answering the survey questions about the CMHRS services. However, when we are talking about EBPs, many EBPs are provided on an outpatient basis. So when inputting data about EBPs, and if you provide that EBP on a strictly outpatient basis, yes, we do want to hear from you. Yes, we do want to understand how you're providing that and how much it costs to do so. So there's a little bit of nuance there, and I appreciate that might be slightly confusing. The next question was, should only one survey per agency be completed? My answer to that, and Brenda, you can, certainly chime in if I'm wrong, is that we would prefer one survey per agency. However, the survey does not prevent you from submitting more than one. And if there is a specific reason why you need to submit more than one, we're certainly not going to stop you. It would be helpful to note that when you're submitting your information in the survey. Brenda, is that completely wrong?
No, that's correct. And the reason why you might have more than one survey per agency might be that you want to provide costs and utilization on multiple services distinctly, and it's just easier to do it that way. If
Yep.
that is the case, then however you can do this, that it would be easiest for you and for us to understand the data you're providing us, certainly would be appreciated. And we do really, we don't mean to beg, but we really do want some cost data and utilization data from some of the providers that are on this call. Please don't, not everybody in the state should just stop after section 2. We really want some providers to go on and bite the bullet and submit cost and utilization data for section 3 and section 4. That will really help us have input and a realistic base to set the rates.
Yeah, I know it's probably the cost information can potentially be a heavy lift for some agencies, depending on how much, research and time you're going to have to take to sort of get that information. But Brenda's correct. The whole entire survey is incredibly important. But in terms of setting rates, which I know is important to all of us, um, it is extremely important we get some cost information from you all. We all know that costs have increased post, quote unquote, post COVID. And with inflation and many other reasons with our workforce shortages. So it's really important that we hear from you all about that information so we can really dig into it. And we're excited to see it. We hope that you all have time to get us some of that information. All right, next question is, if we do not own an agency but work within the CMHRS sphere, and we still want to provide input on what we think should be reformed or maintained, can we still fill out the survey? Yes, please. Please do so. We definitely want to hear from any provider and what their thoughts are. If you don't have cost information, that's perfectly fine. The narrative questions are certainly important to us and hearing your opinion about the services, the good things, the bad things, the barriers, all of those things we definitely want to hear about. All right. My friend Brandy Williams is asking if a PDF version of the survey will be sent out. Yes, it will. We're going to be sending out the PowerPoint, a link to the survey, and a PDF. We understand that it will be much easier to have the PDF so you guys can see what the questions are and research before submitting the survey. I do want to say that I'm thankful to Brenda. Brenda made the survey and made it so you can actually save as you go and come back to it as well. So it is built in that way. So hopefully that will help as well. But yes, we will be sending out the PDF version of the survey to anybody who registered. And then once we get our website up and running, it'll be posted. I hope the website will be up and running in the next few days. All right, next question is, should the EVP section only be answered if the listed EVPs are used currently in CMHRS services? No, whether you use it as CMHRS service or you use it for a different service or separately, we want to hear all of that. We want to hear from any provider of any of the EVPs that we specified in the survey, no matter how you provide it or what modality you provide it in. So more information is better in this moment. So thank you. And those were the ones that I answered. It looks like since I've been talking, we have more questions come in. And let's see if I can read them quickly and potentially answer
I can
them off the
answer
top of my head.
Yeah, I can answer the first one.
Oh, fantastic.
Yeah, for Taisha, we have a license for TDT and MHSS, but TDT is not operated since COVID. Do we answer for both programs or just active programs? We really just want you to answer for the active programs because I'm assuming if it hasn't been active since COVID, you haven't actually had that program up and running since 2020. And so we really are wanting to know about the cost and utilization of the most recent 12 months, which presumably for TDT would be zero in the last 12 months, or even and we're being very generous to say it can be the last calendar year, the last fiscal year, et cetera. But if you don't have costs and utilization for the last couple of years, we would prefer that you not report on them.
Thank you, Brenda. We had a similar question. Is the survey only for organizations who have been providing services for 12 months? So there are several sections to the survey. The narrative portion is for any provider who wants to provide their thoughts in the narrative portion. The cost questions, as Brenda said, are for the past 12 months, the cost for the service. So There are portions of the survey that anybody, any provider can fill out, and then for the cost section, it would be for the last 12 months if you've been providing the service. Does this pertain to PRTFs? No, this survey does not pertain to our psychiatric treatment facilities. This only pertains to our community-based mental health services. Let's see. Does this affect ABA? Applied behavior analysis? No, it does not affect ABA. This survey is not related to our ABA service. So we do not need ABA providers providing any cost information. To clarify, will we be able to access the survey outside of the QR link? Yes, we will send out the link to the survey, and once our website gets up and running, we'll post the link on our website.
And I will point out that the link to the survey is also the blue underlined web link on the top left of the screen. So you can also just write down that HTTPS formsoffice.com RAN 8N, etc. That link will also take you to the survey.
I'm actually going to ask my colleague Stephanie if you could put a link in the chat with that link, please.
Yep, we'll do.
It will certainly, thank you. It'll certainly be sent out afterwards as well. All right. And can you, let's see, second question from this individual, and can you differentiate targeted case management from other case management services? Foster care case management is separate, correct? Yes. So we have, I appreciate this question. We have 3 different case management services, and they are mental health case management, which by code is only provided by our community services boards. We have our substance use disorder case management, which can be provided by any approved appropriate provider. And we have foster care case management services, which is a carved out service and is managed under fee for service. The service that we are looking for feedback on is specifically our mental health case management service that is currently provided only by our community services boards.
So Wendy is asking a question about, can the survey be saved and reopened several times, or does it need to be completed in one setting? We have got the settings on the survey so that you can save it and reopen it. However, Wendy, if you have problems with that, please don't hesitate to let us know. But that is how the settings are set up. And hopefully that will work for you. You'll notice that I am being cautious, overly cautious about overselling the operation of the survey.
It's going to work perfectly. No, nothing's ever perfect. I am sure there will be potential glitches, and that is why we're having provider office hours, and we can work through those. Are rates going to look different for other community services boards? I'm not exactly sure I understand that question. Alicia, I'm wondering if you could restate that question and put your contact information in the question so that we can get back to you and get some more information from you. If you're submitting a question, please make sure you're submitting it with your contact information and your name and your agency if you have one, because we may not be able to answer every single question. Lenore, when should we expect additional information pertaining to the redesign and how it might affect our organization? again, we're in planning stages for the next year. We will have over the next year multiple public webinars that will be giving updates about where we are in that planning stage. Right now, we are in the planning stage or the implementation stage of our stakeholder engagement. So over the next 2 months, our team and the Mercer team, much of our stakeholder engagement will be completed in the next 2 months. This is actually the kickoff of our stakeholder engagement. So that's the phase in which we are in terms of planning. I think the hope would be sometime early next year or in the spring, we'll probably do another public webinar to let folks know about what's going on. There's a lot of pieces to the puzzle that have to come to fruition before we can give you sort of finalized information. If we can give it to you before, we'll do it as soon as we can, but I'm not going to promise that we can do one before the end of the calendar year. All right. Brian, will the process be a smooth transition so it doesn't affect the individuals receiving service for intensive and home? We that will be part of our year 2 planning, and we had a lot of planning around that specific issue when we did our project implementation of our Project Bravo services and had to transition our members to new services. So we worked a great deal with our managed care organizations on really making that as smooth as possible, a transition for the individuals that we serve. So that is absolutely in the forefront of our minds. We will have what we will put together a transition plan for each health plan, and we will work with each health plan to make that happen. They'll be giving us updates, all of that stuff. So yes, that is absolutely in the forefront of our minds when implementation gets closer. Most likely those plans will be developed in year 2 of the project. All right, another TCM question that I think we answered. Is there a way to register to receive updates linked to this and any other important updates issues in the future? So in terms of this project, there is not a specific way to get updates on this project, other than we'll be launching our website and posting information there as we have it. We generally send out our information via our provider enrollment system. And you can also go on our website and sign up for our Partners Point newsletter. We will probably be putting out some information via that newsletter as well. Other than that, those are the ways that you can get information about how the project is going. And then we often send out our information to all of our provider associations and to our partners at DBHDS and some other partners, our health plan partners as well, so they can get it out to their networks. Are they going to have set certain rates, City of Virginia Beach? So I think the questions about rates at this point are not something that we can really answer. Alicia, thank you for your question. We'll have more information about rates in late spring, early summer of next year. But whatever services we decide to implement, each of those services will have a specific rate. What that will look like, we don't know yet. This is the start of getting some information to start our rate study. But as you all know, there are different types of rates we can have. There's, a per day rate, there's per 15 minutes, there's all sorts of things that we can do with rates. So those discussions really haven't started, but in terms of each service that we implement, yes, we'll have a specific rate. We do not, at this moment, I can't say that we wouldn't, but at this moment in Virginia, we do not do regionalized rates. The rates for our current services are all the same, no matter where you live or provide service in the state of Virginia. I don't expect that to change, but ultimately I can't promise that because we haven't started our rate study, and Brenda and her team are way more knowledgeable about all of that stuff than I am. But as soon as we have information about the rates, we'll let you know. But this is a good first step. Hopefully we'll hear from you in the survey. Will the Q&A be summarized and provided? I was able to see the Q&A initially, but no longer able to view the new questions. I don't know the answer to that, Barbie, but we will take that back and let you guys know if the Q&A is going to be published. Would it be helpful for you to include the CPT codes for this survey so we know exactly which services to include?
And I can make sure that the HCPCS codes for the CMHRS services are in section 4. I think the issue for evidence-based practices is some of them are not independently reimbursed by Medicaid. And so we don't actually have like a one-to-one CPT code. And so like for coordinated specialty care, I mean, CMS just approved the HCPCS codes for those, a few months ago. So no one's using those. So it would be, we will go back though and add in the CMHRS HCPCS codes for those services.
Brenda. Looks like there's some questions we already answered. Yes, you'll get a copy of all the questions of the survey. Yes, you will be able to get a copy of the presentation sent to you. All of that will be sent out after the webinar today. Is case management going to be a tiered service, tiered reimbursement? Again, we are in the planning stages of what types of services and how we want to replace our CMHRS services. One of our priorities for this project is to have tiered services in general. Which services will actually be tiered? We have yet to make that decision. Again, we're going to be looking for feedback on that. So please, if that's something that you feel passionate about and you have information about and want to provide it, please provide that in the narrative section of the survey. We would love to read your thoughts about tiered services.
There is a question from Lenore asking, is there a hold on licenses for CMHRS services, or can we continue to add services during the redesign? And Laura, do you know the answer to that, or will we have to get back with Lenore?
There is currently no hold via the DBHDS process on CMHRS services licenses. So at this moment, you can still add a CMHRS service. DBHDS licenses are generally agnostic of payer. So at this moment, there's no hold. I don't know that DBHDS has any plans to do that in the future. That's not something we've discussed yet.
There was one question from Shanae McCrae that says, if an agency provides 4 of the 5 services indicated, should we just select one service to provide cost and utilization on? You can certainly do that, or you can, we would prefer that you separately provide cost information on any service that you do provide costs on. And so most of the responses are a narrative. And so you can say, okay, for MHRSS, we do this. For IHS, we do this. or you can actually do different surveys for each service. It really is up to you. Shanae, however, is easiest for you. We would love it if you would give us cost information separately for all four of your services, especially if you're willing to do that.
Shanae, my friend, I know this is going to be a heavy lift doing 4 to 5 different, well, submitting 4 to 5 separate surveys for each service that you all provide. But if that is even possible, like Brenda said, in terms of time and bandwidth for you all, we would love to have the data.
Yep.
So
And if you can only do one, then we'll take one. But yeah, we appreciate you all. So there's a question from Negli Hernandez. Can we make suggestions on employee-based criteria or just on services? I'm not sure I understand what that question is.
sorry, Brenda, where are we?
It was somebody put that in the chat. So
Oh,
yeah, if you could move that over to the questions and answers and just explain what you mean by employee-based criteria or just on services. I just don't know what that means. Yeah, we have a few questions that came in under the chat.
I'm not sure either, Brenda.
Yeah. Ah, okay.
Mhm. So I think that's the majority of the questions. Um, I know there's probably a couple that we weren't able to answer. Um, please keep those questions, write those questions down, bring them to our provider office hours. Again, there'll be 2 opportunities to attend office hours, which is a very informal come as you are and come and go as you please to just ask your questions. And it will be our team and the Mercer team trying to answer those questions for you. If you have any specific questions about your specific agency, pertaining to the questions that we have on the service or the survey, it's a good time to bring those. I see that we have people asking for my email address about how they can get in touch with me. I would prefer, although I love all of you, I get hundreds of emails a day, and most likely your email will be buried in my inbox. So it's best to email our divisional mailbox, which has been put in the chat. Thank you for whoever did that. I don't think it was one of our team. I think it was a provider. So thank you so much. It's enhancedbh@dmas.virginia.gov. Please send it there so it can get triaged and not sit below 200 emails in my inbox and not be answered. So I appreciate everybody's questions. Stephanie, thank you for putting the links to the office hours and the times and the dates in the chat. Again, all of that information will be sent out to everybody who registered after the webinar. So we appreciate everybody's questions, and we hope to see you all at office hours. And please, 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 I know Brenda said she wasn't going to beg, but I'm going to beg. We really need this information from you all. It is a critical point to this project to get this information from you all. And hopefully we've made it as easy as possible, although I know it's not going to be entirely easy to get your hands on the information, but this is just a really critical part of our project, and we appreciate all of you taking the time to be here today and to filling out the survey in advance. Brenda, anybody else on the team have any parting words?
Someone has raised their hand, Regina
Okay,
Autry. Um,
okay.
is it possible you could type your survey, your question into the Q&A?
And the reason I'm seeing it in the Q&A that folks are saying that the Q&A they could see it until 2:22 and then it stopped showing new questions. The reason that is because that's when I stopped answering the questions, the Q&A, and went live to answering the questions. So I haven't actually typed the answers to the questions in the Q&A yet for those that have submitted.
Um,
Um,
There's another new Q&A. Will insurance companies be included in with the upcoming changes to ensure that everyone is on the same page as far as authorizations and reauthorizations? Yes, we do intend to include the insurance companies in all of the discussions about authorizations and reauthorizations.
Yeah, the managed care organizations and our fee-for-service contractor are certainly key stakeholders. And we have already started engaging them in this process. And we'll be giving them lots of guidance around what to do. And just like the rest of our stakeholders will need to be educated about the new services, so will our health plans. So we'll have, a specific education plan for how we're going to make that happen. And of course, nothing is perfect, and we know that DMAS is not perfect, nor are our health plans. But we're going to do our absolute best to make sure everybody's educated and can move forward for implementation of the new services. All right, I see my fearless leader, Dr. Lisa Job Shields on camera. Lisa, do you have any parting words today?
No, no, I just put mine in the chat. We really appreciate everybody considering doing the survey. Even if you're only able to do the narrative questions, we really appreciate that too. But if you are able to take the time and dig in and give us that really specific information about cost and utilization, that's really going to be the core of what we need to look at to do a really good job on this rate study. So just want to thank everyone in advance, and please use the office hours and the email address, and anything else you need to get the support to complete it for us. Thanks.
Thank you all very much. Thank you, Brenda, very, very much. And Carly, I think we're going to leave it at that, and we will talk to you all soon. Thanks, guys.